Hi, I'm Professor Jennifer Donnelly. I'm a consultant obstetrician, maternal fetal medicine specialist, and I'm here with my colleague, Professor Fionnuala, consultant hematologist. We work in the Rotunda Hospital, in the Royal College of Surgeons of Ireland, and in the Mater Hospital with UCD. And together, we are delighted to be here to discuss the HIGHLOW trial, which has recently been published in The Lancet, which looks at prevention of blood clots in pregnancy for women who've had a previous birth. The HIGHLOW study was led by Professor Saskia Middeldoor from the Netherlands, and it's an international multi-centre trial that was funded here in Ireland by the HRB.
Venous thromboembolism, or dangerous blood clots in the veins, can affect anyone. What it means is a blood clot in the veins of the legs, called a deep vein thrombosis, or one in the chest called a pulmonary embolism. And what's really important is that blood clots are much more common in pregnant women than they are in women of the same age who are not pregnant. And tragically, venous thromboembolism is still the most important cause of tragically women dying in childbirth or after childbirth as a cause of the pregnancy itself. So it's so important that we pay particular attention to it. And even in women who have had a blood clot and who survive, they can have long-term consequences. And so preventing a recurrence of a blood clot in a woman who's pregnant now is incredibly important. And of course, what I mean by that is, if you've been affected by a blood clot in the past and you're now pregnant, we do the very best that we can to make sure that we prevent that event from happening again when you're pregnant.
Despite the fact that we know that blood clots in pregnancy can be fatal or cause very serious complications, up until recently we didn't know what was the best way to prevent blood clots from reoccurring in pregnancy. There has been a lot of academic discussion and papers published in the literature looking at which is the best way. However, until the HIGHLOW study, we had no good evidence from a randomized control trial in order to best advise women on what to do. And that is why we are so delighted that we now have evidence as to what is the best way to approach pregnancy with women who've had a blood clot before.
A randomized control trial is the highest level of evidence from a clinical trial that we possibly can have. Sometimes in a randomized control trial, where people are randomly given usually one of two different treatments, sometimes the identity of each treatment is unknown to the person getting the treatment and to the person prescribing the treatment. In HIGHLOW, this wasn't possible, and it wouldn't have been ethical because the amount of blood thinner in each part of the trial had to be known in order that we could take best care of the women who were participating.
So prior to the HIGHLOW study commencing in 2013, we knew that low molecular weight heparin is a medication that is safe to use in pregnancy. But what we didn't know was what was the best dose to use for preventing future blood clots. And there are many guidelines that guide clinical practice, and some of them were at odds to decide which was the best dose because the evidence wasn't there. And that's what the HIGHLOW study set out to do, to try and answer the question, which dose is best at preventing blood clots in pregnancy. So we knew that low molecular weight heparin was safe, and we knew that it could be used for both prevention and treatment of blood clots in pregnancy, but we didn't know which was the best dose, which was safest to prevent blood clots returning, but also wasn't associated with an increased risk to the woman from bleeding, which could be a side effect from the medication.
It is awful that pregnant women have been excluded from these incredibly important clinical trials. Importantly, they've been excluded, most particularly from the highest form of evidence that we have, which is randomized controlled trials. And this has created inequality, which is what this initiative is all about. It's just not right that women who are pregnant, who often have the most to gain from good quality data and the most to lose from not having it, are so often excluded from trials. And in the past, it was sometimes even thought that you just couldn't get these types of trials done. But under the leadership of this terrific team, it's been shown that excellent, high quality clinical trials in pregnant women, even in challenging conditions such as blood clots, can be done.
Without doubt, they're critical. This study could not have been done without cooperation and coordination. I would really like to point out the great leadership shown by Professor Saskia Middeldorp in the Netherlands, who has been driving women-focused research for many, many years to try and answer some of these questions and inequalities. And her leadership brought a wide group of people together across nations, across academic sites, in order to try and improve care for women. And that has proven to be critical. We have the science backup, the hematology backup, the understanding of the obstetric changes. We've had radiology input, and of course women themselves centrally. And so this has really been critical to getting this study done. I think the secret to the success of this study for us here was the willingness of women to participate in the study and to give us their trust in order to guide their care through pregnancy. We were very fortunate to have an excellent clinical team here where we work closely together between obstetrics and hematology with women attending the service to make a plan that's safe for them. And many women who have come to the study have previously had a blood clot in pregnancy, so they would have been familiar with our service. And then when they came back into a next pregnancy, which was fraught with worry for them in many cases, they knew they wanted to do the best in order to get the answers that they needed to keep themselves and their babies safe. So I think teamwork, communication, and the trust of women attending the hospital was key to our success.
I couldn't agree more, Professor Donnelly. The second thing that was so instrumental in the success of HIGHLOW, I think, both nationally and internationally, was leadership. And we had the great honour of working under the absolutely outstanding leadership of Professor Saskia Middeldorp in the Netherlands. And through her immense efforts, the entire multidisciplinary international team made this trial a success and delivered the results for the benefit of our women. Secondly, I'd like to acknowledge the leadership of yourself, of my colleague, Professor Jennifer Donnelly, who led the study here at the Rotunda Hospital, and without whose involvement in this study and in excellent world-class care for pregnant women in general, this study would not have been possible. Indeed, the leadership of all our colleagues in Ireland who were involved in this study, in the Coombe under the leadership of Professor Bridget Byrne and Dr. Kevin Ryan, in Limerick under the leadership of Dr. Dennis O'Keefe and Professor Mike Watts, and all of their incredibly important input from midwifery and other multidisciplinary colleagues was crucial. Overall, we were deeply, deeply grateful in Ireland to the tremendous infrastructure of the Mother and Baby Network, and also we were proud to be able to run this trial as part of the work done by the Irish Network for VTE Research. And this study did what the networks go out to do, which is to answer those questions that are so important to our patients. Every important trial has challenges. We were deeply grateful to the Health Research Board of Ireland, who funded the Irish arm of this study. 1 in 10 women who participated in this study came from clinics in Ireland. And this funding and the determination to help fund pregnancy important clinical trials really addressed a huge number of our challenges. And we will always be grateful for that funding. through that funding and through conducting this trial and making it a reality, a lot of firsts were seen for us. So as a team, we I think have developed now in Ireland the tools and the capability to set forward now and answer similar questions in the future. We had to navigate a number of huge challenges: regulatory, contractual, negotiation with new legislation, and the GDPR legislation came to pass while we were conducting our trial. And we, through the team, through your leadership, Professor Donnelly, we succeeded in navigating these challenges. And we learned a lot. And now we are so proud to be part of an international network that is already beginning to deliver on other very high quality randomised trials.
So as Professor Fionnuala has said, I mean, the regulatory challenges, which has made us stronger actually in terms of negotiating them across national borders, in the EU and outside. It was challenging, but definitely worthwhile. And although things sometimes seem to move slowly, ultimately they made the study better. And I think a lot of that is as well is to do with the support that we've had from our academic infrastructure, and we're really grateful for that. And how could we forget COVID that came in at the end and maybe just put a different spin on things, because as we know that COVID can increase the risk of VTE in pregnancy, so it came more to the fore of everyone's minds, but it did make running and recruiting to an academic trial a lot more challenging in a very busy clinical environment, but we were able to safely overcome it.
And of course, finally, we are deeply grateful to the Royal College of Surgeons in Ireland for their leadership in putting together a truly phenomenal team that helped us to run this trial in Ireland for the benefit of our patients.
We couldn't have done it without them. HIGHLOW has been a very long gestation, and through that, a number of really key people we've worked with here in the RCSI Rotunda, and I'd really particularly like to thank Dr. Liz Tully, Alma O'Reilly, Lucy Murphy in the RCSI team in the Mother and Baby Network, who were just fantastic support to us throughout getting set up, negotiating all of the challenges that we've mentioned. We also couldn't have done this without our pharmacy colleagues, Professor Brian Cleary, Dr. Fergal O'Shaughnessy and Elena Fernandez, trial pharmacist. And this is, again, evidence of great multidisciplinary teamwork. And then radiology, Dr. Peter McMahon in the Mater Hospital, who was critical as well for providing radiology support. And this all brings us back to where we are today, and Dr. Tully has passed the mantle over to Zara Mulphy, who we're deeply grateful to for organising and supporting us, because as busy clinicians, we couldn't do this without a really excellent support and leadership from her and her team. So thank you. This is a groundbreaking study. I would really like to re-emphasise the importance of this for the care of pregnant women. We now have excellent, high-quality evidence as to the best way of preventing blood clots in pregnant women during and shortly after pregnancy. This study will influence guidelines and therefore has the potential to touch the lives of women and their families around the world.